So, I've been dealing with suicide most of my life.
Mary Nakwanekapo lives in Wab-Markstow, an isolated community near James Bay in northern Quebec.
Why did you go?
Suicide took her half-brother and half-sister, as well as her cousin, a musician whose talent once brought joy. At age 13, she had to help her mother, who suffered from schizophrenia.
I was trying to stop her to end her life, and I had no clue why I was dealing with this alone.
Nakwanekapo also carries the heavy burden of prejudice against mental health.
There's a lot of stigma with mental health, especially my mom being schizophrenic, me being bipolar.
In 2016, her living conditions were difficult, and she made several attempts.
I tried to get through the night, and going to social services and going to the police, I did that in 2016. I ended up at Douglas Hospital.
Last August, Mary had the names of her children tattooed on her arm to help her through difficult times. It was the suggestion of a nurse.
When you're in that mood or in state, look at those tattoos and see why you're fighting to be here.
She is 49 years old and she is sober since 2018. This battle has long been a daily struggle.
I still have panic attacks to a point where I'm always staying home.
Nakwanekapo believes that community support services are inadequate.
I think what we need is more AA meetings or support system, more treatments, detox centers, and the community.
If more services were in place outside of Montreal, she would avoid travel outside the community and having to face the loneliness of the big city. If needed, she knows that talking makes her feel better.
I reach out to my friends, my coworkers, kudos to them.
Nakwanekapo believes that listening can make a big difference. One she also wants to make on social media.
I share daily on my Facebook my struggles just to help someone, say they're not alone.
Stéphanie Desèvres, APTN National News, Montreal.